very much. So I'm going to give a very brief overview of some highlights and I think opportunities as we move forward with the AI revolution. And just to ask a question of you all, how many of you are users of ChatGPT? Wow. Keep your hands up. I think that's about 75, 80%. Anybody using DeepSeek? Okay, I'd say that's about 5%.
Rock?
Oh, rock, okay. Rock. All of them, all of the above. And just to ask a further question, how many of you who are using any of the tools once a day, 5 times a day, 10 times a day? Let's start with just about once a day. Okay, probably about 10%. 5 times a day? 10 times a day? Okay, I think there's a sort of normal distribution there. And I'm 20 times a day on average. I am a complete passionate enthusiast of ChatGPT, and it's absolutely transformed my life, and I'm constantly learning and improving. But there's lots more to AI, of course, than ChatGPT. So I'm going to just remind you a little bit about the terminology and the headlines of what are the main areas for relevance of AI, and some of the pros and cons in consideration, and then really to focus on Africa. Where are we at? What is the status of the response? What are probably some of the core opportunities in sub-Saharan Africa? And some examples of the startups. And I should say Africa is really incredibly dynamic, and I'm not sure many of you are aware of quite how many thousands of startups there are across the continent. So just to remind you of the terminology, and really just focusing on the left bar with the sort of AI, of really AI being intelligent machines capable of performing tasks that typically would require human intelligence. And then embedded in that is the machine learning. So that's really the algorithms that enable the computers to learn and improve upon. So the algorithms are improving without the need for additional explicit programming. So they're using the data they're exposed to. And then within machine learning, and this is the area that's really taken off over the last 5-10 years, is the deep learning. And that's really a subset of machine learning that utilizes multi-layered neural network layers to extract and learn and pick up features that then are part of the automatic improvement. And I think the machine learning, I think just so you're aware of the terminology between supervised and unsupervised, but just one other comment on deep learning is that this is the approach that is particularly relevant to the scanning of images, which has become so much at the forefront of the applications of AI, and also for example, ChatGPT. So what are the areas where AI is being applied in healthcare? Well, on the left is a 360-degree look at this, and probably only some of these areas at the moment are relevant or most relevant to sub-Saharan Africa. I think the medical image diagnosis and the more general diagnostics is highly relevant. Perhaps a little less so at the moment on drug discovery and the personalized medicine and the medical robotics. I think going forward, the electronic health records is going to be very important. And it was interesting to hear from a dinner discussion we had with Uganda and other countries last night that they're going in Uganda paperless, and that the importance of really having high quality EMRs, which will particularly relate to applications with AI. I think they're proving also AI more in the sort of high income settings, drug discovery, the clinical trials. And then the other area that's particularly relevant to sub-Saharan Africa is some of the disease surveillance, the outbreak prediction, and disaster and humanitarian response. So more than almost any other area of the use of AI, there's really been a massive growth in the use of AI in the healthcare sector. And that's in part because there's a lot of data out there, and also the availability of complex medical data sets, not just more classic observational data. And I think the arrival of the deep learning and neural networks, and you see on the right shows you the PubMed for the different AI, then the machine learning, and then the deep learning, and it really took off in terms of the outputs in the last sort of 5 to 8 years. And that's been a huge driver because you then have these much more complex algorithms that can synthesize these multi-dimensional data. And then, of course, the recognition of high healthcare costs, and this is in all settings, and the need to drive those efficiencies. And many pharma companies, biotech companies, have really adopted and embraced and formed partnerships, and so that has also driven things. I think in terms of you look at by decades and what's happened, the interface with AI has really changed from being rather physician-centric to really where we are now, more patient-centric. And for those of you, and I'm one of them, that have the wearables and the Apple Watch and other devices, I think that's very much defined this era. But looking forward, I think the area of robotics in surgery, and much more also on the sort of telehealth side of things. And that, on the right, is just the schematic of how things look for the future, with the interface between the hospital setting and the collection and the monitoring of data, the use of wearables in the home, and then how that can also relate to teleconsultations and monitoring. So, and I think in 2020, the value of the AI industry in health was about $4.5 billion. It's projected by 2026 to be 46 billion. So almost a 50% increase that's anticipated now over that this 5 years from 2020 to 2026. And I think it's interesting to look at some of the data on where are the real growth and investment areas. And drugs, cancer, drug discovery has been a big driver of AI as in the health sector, as compared with the many other areas you see there. And on the right, again, this is looking at sort of publications and what are the areas in medicine where there's the most activity. And as you would expect, pathology and radiology account for the bulk. And then in terms of disease areas, it's the oncologies, the cancers, neurology, psychiatry. Gastroenterology and hepatology is sort of much less visible. So there are certain areas that have been particularly amenable to that. And then I think just in terms of some of the surveys that's been done about where are the disciplines and the areas of the diseases that it is thought there's going to be most applications. And it really is many of the kind of chronic non-communicable diseases, but also infectious diseases as well are scoring highly. So I think this will be familiar to many of you, the pros and cons. And there's no doubt, and particularly on the diagnostics side and the imaging, this opportunity for improved accuracy. And because of the speed in which the radiological assessments can be done using AI, the ability to just, for the patients to receive their treatment, to be correctly diagnosed much faster, by reducing labor costs and streamlining workflows, really improving the efficiency and cost effectiveness of delivery of care. And this is particularly relevant to sub-Saharan Africa, that expanded access makes healthcare so much more accessible, particularly in remote areas. But the challenges, which you'll have all heard about, the privacy, the security, the bias in the algorithms, and particularly focused on more the Western context, the ethical considerations, amongst others. So moving to Africa, what are the kind of realities that are the drivers? I think, as we all know, the insufficient healthcare facilities, and including the drugs, the diagnostics, the equipment, particularly in rural areas, the shortage of healthcare professionals, who are often geographically mal-distributed, less in the rural areas, so you've got less access to quality or specialist care when you need it, the transportation issues, the high burden of disease. But the opportunities, I think what's really was always very striking to me is the very wide usage of mobile phones and the embracing and rapid digital uptake. And it was interesting to me to hear that Romania in Europe has the fastest internet. And I asked the question, why? It's because they didn't have much of an infrastructure to start with, so they could, they came in with something new right from the start, and they didn't like having, where I live in the UK, where we've still got copper wires buried in the soil, and so you can start afresh. So I think there's an advantage in that you can leapfrog many of the kind of iterative processes. I think the workforce shortages just means AI for decision support and triage is valuable, and there is an evolution in some of the national digital health strategies. But the challenges are the lack of digitization of the EMRs and patient records, the lack of internet access in many areas, still relatively few government strategies, initially high costs, it's new concepts to many medical professionals, and concerns about loss of jobs. So these are the AI strategies in Africa. There's only really 16 countries that have got national strategies, and the leaders really are Kenya, Egypt, Ghana, Algeria, Rwanda, and Senegal. I'm not quite sure whether Nigeria has now published its strategy, but it was still in evolution. But there are 30 countries that have not, or are still at a very early stage, and obviously the conflict affected countries have not taken that forward. What are the main areas? I think telemedicine, remote patient monitoring, has emerged as the most sort of active area. Sexual and maternal and child health, and healthcare operations in hospitals. The hotspot sort of countries that are really the drivers, it's the Kenya, South Africa, Uganda, Nigeria, and Ghana are the most active, and that chart just shows the sort of reported activity. And the organizations leading AI in these different countries, largely private sector, largely startups, followed by about 30% academia, and still relatively little in civil society. So just the last few slides are medical imaging, I think, is just extraordinary what can be done now with chest X-ray scans, MRI, CT scans, and pathology, of course. And, a perfect example is this AI for diabetic retinopathy screening. It means non-clinicians can be trained on the imaging and will immediately get interpretation of the images, allowing immediate patient feedback. Chest X-ray, again, AI picking up what seems to be an unclear lesion in the right upper lobe, proceeding immediately automated to a CT scan, and then with the coming back with the predictive value of the diagnosis being 0.85. And this was something as lung cancer and was missed by a board registered radiologist. So this is just one example. On the left, you also see some examples of the companies operating in this space and which countries they're in. Similarly on the diagnostics, and I think the growth of rapid point-of-care tests, some of which have a sensor and can report results, is an opportunity. There's some many startups now focusing on, 14 chest conditions, and obviously breast cancer with mammograms is very relevant. The telemedicine and remote patient monitoring, this can be through video conferencing, instant messaging, smartphones, chatbots, other examples. And I think there's a really interesting company that's doing the scanning of paper to digital to get information of handwritten notes and trying to automate that. So it's all exciting. Healthcare operations, EMR, hospitals using it to forecast. Example of a company that offers a patient portal, a doctor portal, hospital management system. And then I think, not surprisingly relevant to Africa, are some of these surveillance, data-driven surveillance model where you're integrating multiple data sources, climate, population, health data, surveillance data, to come up with early warning systems. So quite a number of major funders. I think Bill and Melinda Gates supporting AI through the Grand Challenges, Chan Zuckerberg, so the people you might expect, big tech companies, and there's a very nice collaboration between the sort of Swedish development organization and Canada for this artificial intelligence for development in Africa. And I think in Ghana, which I hadn't been aware of, Google opened its first community AI center in Accra with a whole range of plans and activities, from giving funding for startups, and not just focusing, of course, on health, but it's crop resilience, climate change, traffic management, which I think is really important. And then I think some key recommendations that have emerged on what needs to happen next. That's standardized, fostering that AI entrepreneurship, developing the relevant policies, and a lot of the international agencies are supporting that regulatory structure, really training programs on AI, and that needs to happen in the health sector, and really sort of promoting the benefits and limitations so we all become informed. And then encouraging those public-private partnerships and the South-South cooperation and learning. And I think this is a conference I would strongly promote. I've been to it twice now. It has 20 UN agencies involved as well. It's free, which is almost unheard of, and covers the whole gamut of applications. I think there were 15,000 people in Geneva just a few months ago. There's more than 20 AI conferences happening across Africa. There's a major one that's happening in Johannesburg at the end of October. So a lot of activity right across the continent. And I think lots of positive messages about the opportunities in the future. But AI won't replace you, but someone empowered by AI probably will. And, of course, to quote the impossible not to quote Donald Trump just a few days ago, AI is taking over the world. This is when he was surrounded by the tech bosses in London. I hope the tech bosses know what they're doing, because I don't. And we'll quote him on that. Thank you.